Welcome back. Joining us now, Dr. Melissa Marks, assistant professor in the Department of International Health at the Johns Hopkins Bloomberg School of Public Health. Doc is here to talk about tracing and what the public needs to know about it. Dr. Marks, thank you. Let's start with contact tracing 101. What does that mean? Why is this essential right now?
Well, first of all, thanks for inviting me. And second of all, let me tell you about contact tracing. It's a really important part of our multi-pronged strategy to contain COVID-19, alongside of what we've heard a lot about, physical distancing and individual prevention measures. Contact tracing in particular can help us to keep people who are exposed from exposing other people and break the chain of infection.
Yeah, for a lot of people, this is a new term, contact tracing, but this has been going on with other diseases, other outbreaks for quite some time. We're just now more familiar with it, yes?
That's right. We've been doing this for STDs, HIV, tuberculosis, and it was instrumental in containing Ebola in West Africa.
Next one for you, Dr. Marks. What do policymakers and the public really need to understand about contact tracing? Do you even think, in your own view, it's being taken seriously enough?
Well, I think people are starting to take it seriously. And I mean, really, it's just a matter of figuring out who people had contact with and how to keep them safe and keep them from infecting other people. And I think it's actually a pretty simple concept. And I think people are starting to understand and getting their heads around it. I think that this course that Johns Hopkins has put together is a really good step for informing both the public and people who may want to become contact tracers.
Next one for you, the Bloomberg School of Public Health, which you're obviously affiliated with. They've started an online contact tracing program. Who is that meant for, and what can people learn about this?
So this course is meant for anyone who wants to know about contact tracing, but it can be taken by people even without a public health background, people without an infectious disease background, and for people who might want to help out with contact tracing, for those who can comprehend the concepts that are shared and are those people who are willing to put in some more time to learn the city and state local health procedures for contact tracing, they could use this as an entree into a temporary or maybe a permanent career in public health.
Something we never thought would be a new job opportunity. And I think you mentioned you don't really need a medical background to become a tracer. Who would be good to do something like this? What job experience or background or personality would help you to become a good contact tracer?
Well, I would say, even though I'm talking about it in quite technical terms and quite like epidemiological framing, this is really about a relationship with a person. You're calling a person who is diagnosed with COVID, you're talking to them about isolation, you're helping them with isolation and answering the questions. Then you're asking for their contacts, you're calling them, talking to them about quarantine, helping them out if they need help, telling them when to seek care. People that you're reaching may be scared or worried or confused, and people that do contact tracing need to be able to provide sound scientific evidence to folks and help to reassure them and link them with services that can help them stay in isolation for cases or in quarantine for people who've been in contact with cases.
Next question for you. Last week, our governor announced that our state is looking to hire up to 20,000 contact tracers. Do you feel 20,000 is enough? We have 40 million people in this state.
Well, there are some modeling exercises that are ongoing to try and figure out how many people we need. I think that this estimate is a good start, and I think that the counties in Maryland and around the tri-state area are doing their best to ramp up capacity as fast as possible. And this course is a good way to reduce the time between when you find someone and when they can get to work.
We're back with Dr. Melissa Marks to talk more about contact tracing, which has become something we're hearing quite a bit lately. Question for you, Doctor. How's this going to play out in communities across the country? Not one set of needs or one set fits all.
That's right. The principles behind contact tracing and the general flow, like the steps that you take to do contact tracing, are somewhat universal, especially for one disease. But each individual jurisdiction will have particular things about the jurisdiction, like a cultural or other factors that need to be taken into account. And people who are trained with the Hopkins course will need to then be trained by each individual state and local health department on what particular issues are important for their jurisdictions and how to operationalize contact tracing in their jurisdictions.
So that said, how are tracers generally deployed? Are they focusing on communities based on size? Would there be more sent to Los Angeles than, say, Montana?
Well, they're based on really the caseload. I mean, you usually the size of the population would be important to know to figure out how many contact tracers you need, but also the size of the outbreak or the size of the pandemic. And the more cases you have, the more contacts you have to contact, and so you'll need more in places with a large outbreak and with higher populations.
We're talking with Dr. Marks from Johns Hopkins. Next one for you. Where do hospitals, doctors all fit into this? Are they already part of the contact tracing process?
Generally, contact tracing is happening from the health departments. The state and local health departments are the ones that contact the cases after they're diagnosed and contact those who've had close contact with the cases. We leave the medical professionals to provide clinical care to the people who are sick.
Mm-hmm. What's your sense of urgency in all this, Dr. Marks? Is this a race against time, as we're led to believe, in terms of getting this out there?
Well, we feel that if the country wants to reopen, we do need to have a system in place that can ensure that we can capture people, not capture, but we can find people who test positive and make sure that their contacts aren't out on the street infecting other people. That's how one way that we can contain the spread of this disease. So yes, it's urgent. And it's not going to be, it's not going to replace these other strategies that we're using, like social distancing or physical distancing, and these personal preventive measures, which are hand washing, wearing a mask, and covering coughs when you're sick. But in addition to those measures, it's really important that we start to put a lot of our effort toward keeping people from unintentionally infecting other people.
Yeah, that's a real hard one, because you and I can have it for 2-3 days, maybe longer, feel great, and be infecting other people, right? I mean, that's the thing, is you don't have to feel sick to be sick.
That's exactly right. And that's why it's important to have lots of contact tracers hired so that we can call the cases immediately upon learning that they're cases. And in some jurisdictions, they're thinking about calling cases when they have the symptoms even before the tests come back to make sure that their contacts are asked to quarantine immediately. So this is a situation where urgent action is needed.
Are you worried about people being worried about their privacy in this day and age on social media? People are worried about, being involved in this process of tracing, being unknowingly inserted with microchips so that we can follow them for whatever reason. How is that? That's a battle for you folks, is it not?
Well, there are lots of applications that are talking about tracing people without their knowledge or with limited knowledge. Contact tracing done through health departments in particular are really personal issues. They're a person to a person. There's a human being calling another human being. And the reason this course is so great is it helps people learning about contact tracing to understand privacy issues, understand confidentiality issues, and to understand the health department's role in and their authority in calling people who have confirmed infections. It also helps people to make people feel comfortable and supported in the contact tracing procedures.
What, in terms of being a contact tracer, what are we looking at income-wise? Is this a volunteer thing? Is this something where people are paid minimum? What are you hearing about that?
Well, the salary or the rate of pay will differ across jurisdictions, but this is not a minimum wage kind of job. This is more than minimum wage, and while there are some volunteers like students at Johns Hopkins and other places helping with contact tracing, really we need a stronger public health system altogether, and bringing in contact tracers is good for now and for the future. We do need to rebuild our public health system so that we're not just responding to each crisis that comes up. And people who can finish a course like this and can successfully work in contact tracing may be good candidates for jobs in health departments.
Quickly, doctor, we're just about out of time. Special gear needed to be a contact tracer?
Contact tracing can happen almost entirely right now by phone. So people are not right now going to people's houses unless there's some special reason, like they're part of a nursing home or some other fragile population. Okay. So for the most part, we're just calling people, and that just requires a phone and headphones and a kind personality, and a personality that wants to help and can understand the material in this course.
Got it. Dr. Marks, thank you. Johns Hopkins, we do appreciate your time.
This interview involves commercial content. The products and services featured appear as paid advertising.